everybody. I'm really looking forward to starting these conversations with important rising Democratic stars who are running in really critical down ballot races this cycle. We'll get going today with one of my favorites, my friend Lauren Underwood, who is currently the U.S. representative for Illinois' 14th congressional district. That's a district that covers the outer western suburbs of Chicago. Lauren is by background a nurse. She's a former Obama administration health policy professional, and she spent a lot of her first term in Congress as part of the 116th Congress, advancing really important legislation like efforts to protect the ACA, to make affordable insurance and medication access available to Americans, and the MOMS Act, which has done some really important work to address the maternal mortality crisis in America. Her bold, get-it-done leadership style in Congress as a freshman has landed her on Time's Next 100 list in 2019. I should tell you that in addition to being a really hardworking member of Congress, I'm also really excited to invest in Lauren's race for the 2020 cycle because in 2018, when she ran her campaign for her first term, she proved that she's an incredibly effective campaigner. She won a hard-fought race and flipped her district, one that had been held by a four-term incumbent, Tea Party Republican Randy Hultgren. And she emerged in that process from a heated Democratic primary in which she bested 6 other candidates, all of whom were older, white men running for office. In the process, she's gone on to become the youngest African-American woman who's sworn into Congress in American history. I should tell you also that Lauren was one of our very original Arena Fellows, which is how I got to know her. So she's a remarkable leader and has unique qualifications and a point of view to offer at this particular moment when America's facing a public health crisis. I'm really looking forward to you getting to know her better in our conversation. Thanks for joining us. I was wondering if you could get started by maybe telling us a little bit more about yourself and why you decided to run. Could you share your leadership story with us?
Sure. I've been a nurse throughout my career and have worked to expand healthcare coverage in communities across our country. I worked to implement the Affordable Care Act at the federal level. We worked on private insurance reform and healthcare quality and Medicare, preventive services, which are the free screenings and vaccines and contraceptive coverage. And then, as Swati mentioned, I did join the Obama administration where we worked on public health emergencies and disasters. We did Ebola, we did Zika, the water crisis in Flint. And I stayed in the administration until the very last day. But I knew that I couldn't help the Trump team that was just coming in take away healthcare coverage from the American people. So I decided to return home to Illinois. Our state expanded Medicaid, and I began working for a Medicaid managed care plan in Chicago when I went to a town hall that my congressman hosted. And it was during the time of Obamacare repeal. And he made a promise. He said that he was only going to support a version of repeal that let people with pre-existing conditions keep their healthcare coverage. Now, that was a promise that was really important to me as a nurse. I worked on the ACA, but I also have a pre-existing condition myself. So I believed him. And then 2 weeks later, he voted for the American Health Care Act, which was a version of repeal that did the opposite, made it cost prohibitive for people like me to get affordable coverage. And I got really upset and decided, you know what, it's on, I'm running, and decided to launch a campaign. And so spent the summer of 2017 figuring out how to do that. And then, took off and was so grateful to have the support of our friends from Arena and so many around the country that when I was sworn in, I knew that we had so much work to do immediately in this healthcare space that I haven't looked back.
That's amazing. Okay, so let's fast forward over the last 20 some months. Your first term as a member of Congress. Can you share a little bit about what among the many accomplishments you've had in Congress in your first term you're most proud of?
Oh, I am so grateful to be able to work on so many issues that touch the lives of people. But my favorite thing to work on is definitely our maternal mortality work. Black women are 3 to 4 times more likely to die as a result of childbirth in the United States. And that has been the case for my entire lifetime. So for the last 30 years, we've had a disparity that's been unchanging and no national initiative to fix it. And so when we look at societies, we typically look at like infant mortality rate. Are they able to
Mm.
keep their babies alive? And that's usually an indicator of the healthcare of that population. Well, if we are struggling to keep our babies alive and our moms alive, what are we really doing here? And so I teamed up with a colleague, Dr. Alma Adams. She's a congresswoman from North Carolina. And we thought that we were just going to work together, the two of us, on this issue. No, we are up to over 100 members. It's bipartisan. We are the
Wow.
largest bipartisan caucus in less than a year. And we just introduced something called the Momnibus, which is a comprehensive suite of 9 bills to tackle this maternal mortality issue and save lives. You know, to be able to identify a problem and work towards a solution that can be bipartisan, that can get broad support in the Congress, and that, you know, people understand. It's not so convoluted, it's not so complicated, it's not even so expensive, right? It's just an issue that hasn't gotten the attention it deserves, and I'm really excited about the progress ahead.
Wow. It's also such a telling example and a reminder that when we change who it is that we elect into office, we can have such a profound impact on lived experiences of Americans that are represented and that that are advocated for.
100%.
Okay, so this is an important point. You're a nurse and a health policy professional, also by
Okay.
background. And as you mentioned, you worked as part of the Obama administration on some really important public health challenges, including parts of their previous pandemic responses. We're facing an unprecedented global pandemic in scale and speed at the moment with coronavirus. Could you share a little bit about what you think is required from elected leadership in America today at this moment to keep Americans more safe and healthy?
Sure. So in public health, there's been this saying for a long time, health in all policies. And if we let that be a guiding approach, then we can find opportunities to improve the health and well-being of American people in all that we do in the public policy arena. That's a good guiding principle day to day. It is critically important during a pandemic. You know, we see the president responding to the market. If the stock market is low, he wants to take aggressive action to try to boost it up that day, but sometimes ignoring what's going on in the healthcare space. The threat that's facing the American people, the threat that's facing the world right now is a threat to our bodies, right? It is an airborne pathogen that attacks our lungs and it's killing people. And having a sole economic response without addressing the core underlying healthcare needs will be ineffective. And so the real challenge that I've seen is that we have had an insufficient response coming out of the executive branch regarding addressing the real healthcare challenge, meaning insufficient testing, right? Not having enough PPE and not turning on the domestic distribution, and not having a clear, scientifically grounded approach to identifying the treatment that is proven to help save lives against the coronavirus. I mean, the way that scientists have been sidelined and researchers have been dismissed throughout the 3 years of this administration has just been appalling. But then to be in the middle of a crisis, and we have an incredible leader like Dr. Tony Fauci, who everyone is just counting on to save us. And even he appears to be in and out day to day, right? And whether or not his best advice is breaking through, that is what's so challenging to me. We need to be centering the science, addressing these healthcare issues. And once we get that under control, we will be able to have our full economic recovery. And America can I mean, we are here, we are still great, we are able to do all these things, but we're not going to be able to break through and recover if we don't address these healthcare issues.
Hmm. Um, by the way, on a personal note, are you using any tools or stress relievers during this time at home to get
Yes.
through?
Yes, I have a book on mindfulness that I've been reading, and then I bought an exercise mat. It's sort of like with like the gym we used to use in gym class when we would practice gymnastics. It's like an inch and a half thick, and I do like my planking and my yoga poses. The hip openers have been so critical. We're sitting and doing these calls, which are great to be able to be connected with people, but I've been used to being mobile much more during the day, so we need to stretch it out every
All
now
right,
and then.
that's a good reminder. Thank you for that. Um, okay, so you're facing reelection in November. Can
Yes.
you give an overview of the reelection race that you're facing this year and what it's looking like so far?
Sure. So I was sworn in January of 2019. But I was elected, right, in November 2018. 2 weeks after my election day, I had my first Republican opponent. Before I'd been sworn in, before I had done anything. It's like they woke up and they were like, who is this person in our seat? We want it back. And from the very beginning, I've known that we were going to have to go about this in a different way. So I've been running for reelection, not because I thought it was time, but because there's always been someone running against me. At the high point, there were 9 Republicans that were running.
Oh
We
my,
just had our primary 2 weeks ago. And so my opponent is a self-funding multimillionaire. He's 40 years my senior, and he owns a chain of ice cream stores in our suburban Chicago area. He has like 40 storefronts. And the ice cream company is named after him. So he has very high name ID. He's run for Congress a number of times. And so, in some respects, we know what kind of candidate he is. We know how he likes to run campaigns. And because so many of my colleagues have been successful in running against him, we sort of know what to expect. The challenge that we face is really a financial one, is that he doesn't have the same disadvantage as every other Republican challenger, or quite candidly, as I do, in having to fundraise to support my reelection. And so that is really where the threat lies. If we are not able to remain financially competitive, we will lose. And we know that in addition to Republican candidates who are self-funders being able to help themselves, the way that the Republican Party supports their candidates, it comes directly through President Trump, right? So he'll have a dinner, $500,000 dinner, and everybody gets a little piece of those contributions. That's very different than how Democrats do their fundraising. And so we have to be creative and aggressive, even during this time of significant downturn and crisis for so many people, because we know that at any point he could start launching attacks, and we have to be able to respond on the campaign side.
yeah, it's interesting. I just recently saw an analysis that shows that because Republicans have done such a great job centralizing their fundraising, they've got a $200 million resource advantage over Democrats already this early in the cycle.
That's right.
And
And
that'll
so
really matter for a race like this one.
I live in a blue state. And so, people typically think that blue states are fine, even in, competitive swing communities like mine. But the fact remains, I have 7 local Democratic parties that are in my 7 counties. One of them has an operating budget of less than $5,000 a year, Swati.
Holy cow.
And that's with me helping them fundraise. And so when we think about the ability for individuals to be competitive in a resource constrained environment, you start to appreciate the uphill climb.
Yeah.
And while we're able to raise resources to be competitive for our congressional race, we also have to keep in mind that we have competitive county board seats, competitive state rep and state senate seats, right? And so it's not enough for me to just win if the people that I represent then don't have great representation at all other levels of government, right?
You
And so
launched an initiative recently
we
to
did.
support other leaders in your area.
We
You want
did.
to
It's
tell us a
called
little?
the Farm Team Pack. And so recognizing this challenge, in 2018, I knew that there were some areas in my community that I would win. And I assumed that all of our friends running for state and local office would win in those communities too. And they didn't. And part of it was a resource issue, part of it was a training issue, and that they just didn't have somebody to turn to ask for strategic advice. And so we started a state level PAC here in Illinois to support those candidates. We endorsed our first slate of 14 people. And we're excited to be able to embrace and support them all the way through election day.
That's incredible. I mean, here we are investing in you as a new generation leader, and you're already turning around and paying it forward and investing in other folks. Um, that's so incredible. Thank you for doing that work.
Well, thank you. Thank you for inspiring me, quite frankly. Thank you.
Okay, so in your 2018 race, it was one of the really interesting races where the ACA question featured pretty centrally and a big part of your challenge to the incumbent. What do you think the top issues are going to be in your reelection campaign?
Well, healthcare is still number one. Even before the pandemic, when we think about all the issues and stressors on the average American and their budget, healthcare ends up being top of mind. And so that's something that we've never stopped focusing on, never stopped working on. And we found some early success. President Trump signed one of my bills into law at the end of 2019 through the appropriations process. It's called the Lower Insulin Costs Now Act, which makes generic insulin available in the marketplace sooner. And that's a good first step, right? A bipartisan bill that can help people both improve their health and well-being and save some money. And, we always are looking for those opportunities. But more broadly, climate change was something that was not even in the top 5 in my community in 2018. It's consistently highly rated. Gun violence prevention is something that we have experienced really directly in my community. We had a workplace shooting in February of 2019 at the Henry Pratt Company. 5 people lost their lives. I guess it's 12 years ago now at Northern Illinois University, there was a campus shooting. And so many of our elementary school students have faced the really challenging reality of these really vivid active shooter drills where they felt like, this year would be the year that it would happen to them. And so now that pressure is disseminated a little bit or dissipated a little bit with the stay-at-home order that we're under, but you're also hearing about, gun shops being listed as essential services and running low on ammunition, and people feeling like they need to arm themselves in order to combat the coronavirus. Is something that I think just culturally, I'm worried in this time of a pandemic about escalating domestic violence and, accidental shootings because guns are kept unlocked and things like that, right? So we know that there is still significant need there. Anti-corruption, right? Money in politics, fair maps, so ending gerrymandering, voting rights. These kinds of pro-democracy reforms are so critical. And then I'll tell you, for the conservative voters in my area, immigration's number 1 for them. And so, my work on the House Homeland Security Committee, I'm the vice chair on that committee, and we've done a lot of work at the border, is something that I talk about quite a bit because I've seen the border wall. And, I've had the chance to talk to now 3 Homeland Security secretaries about what we are really doing to keep our country safe against the full range of threats. And so being able to have that conversation directly is something that I think is really important to respond to the needs of voters in my community.
Could you share a little bit with us about who you've been endorsed by?
Oh, sure. Well, I'm grateful to have the support in this campaign from colleagues like Senator Gillibrand and her Off the Sidelines PAC, from groups like the Brady campaign and Giffords, and, the gun violence prevention space, the League of Conservation Voters and Sierra Club, the climate change space. We do a lot of, fun work around being a proud pro-choice Democratic woman, and so having the support of Emily's List and Planned Parenthood and NARAL is so critical. And then, these democracy reforms are huge. I mean, it cannot be overstated. And so groups like End Citizens United have been great partners for us as we move forward. And so I'm grateful to have the support of so many. The ongoing support of our Arena family has been wonderful. Our friends over at Square One Politics continue to offer advice and support, and I'm grateful. Listen, this campaign started out in 2018 as a do-it-yourself campaign. We built our website, we wrote a launch video with my friend Sarah and I, figuring this out, and we used every single free resource. And that's how we really got connected as Arena Fellows. You all were offering help, and I was like, thank you. And I haven't stopped asking for help since. And so I just appreciate you're always answering the call.
Awesome. All the endorsements.
Yes.
Okay. On the campaign mechanics side,
yes,
could you share a little bit about how your campaign team is adapting to the current realities of virtual campaigning?
Sure. So, we have obviously physical locations across my congressional district, but our campaign staff is working from home, and they have been for several weeks now. As I mentioned, we had a primary on March 17th. And so our governor kept that date. And so, we had people physically going to the polls until that time. And there was such enthusiasm. We exceeded Republican turnout by 20,000 votes. So imagine, in a competitive Republican primary with 7 candidates on their end, Democrats and non-Democrats, right, conservative-leaning independents, moderate Republican women went out and pulled the Democratic ballot to support us by a 20,000 margin above whatever the Republicans did. It's incredible. And so now we're able to shift online, recognizing that the enthusiasm and is there, that we have this high level of engagement among our supporters in the community, and we're able to still do the outreach. We're doing lots of fun video chats. We're able to we're not doing as much like one-on-one outreach because we just won the primary 10 days ago, right? And they all heard from us. So we'll be picking that up again. But there's opportunities to continue this work in a virtual setting with an eye towards November. And so we're not coasting, we're not waiting, we're being really aggressive.
So on that note, how can the folks that are listening get involved to support you? What kind of help do you need?
Well, we need a lot of help just in terms of bodies. We have a good message to share with people and a community that's eager to hear these updates. In my community, it's not one where people used to think about what their member of Congress was doing, right? They weren't calling us every day with Social Security questions or Medicaid questions, and like in terms of the congressional office. And so, it wasn't always a top of mind issue. But in this time that we're in, we know that people are paying attention and they want to hear. So if you want to volunteer to talk to some voters, to do some texting, and to do some direct voter outreach right now in the middle of the country with, the nicest, kindest ladies that are going to answer the phone and engage you right back, we invite you to visit Underwood for Congress. It's Underwood, FOR Congress.com, and you can volunteer with us. We do need to be financially competitive. The realities about our race is that if we can do all that we can to win this race early, we're going to be in good shape. The reality is the presidential election is not one that serves as like a net benefit in my race. President Trump won my district in 2016 by 4 points. And, we can't assume that whoever our Democratic nominee is going to have the support of the majority of voters in my community. And so if we waited to begin our voter outreach until the fall, we would be at a real disadvantage. And so, it is the first week of April. We are getting started now. We have our plans in place. There's no time like the present. And so if we can do two-fronted strategy, which is let's begin our voter outreach, but let's also continue to raise money so that we can be competitive, we're going to be in a very, very good place come the fall. If we didn't do that and we were desperate and, our coffers had gone low and we were basically broke in October, we'd lose, because we know where everyone's attention will be at that point in time. And so just grateful, to be able to continue to do this work and raise some money.
Well, thank you for everything that you do for so many of us, Lauren, and for sharing more of your story and about the contours of the race that you're going to be facing this cycle with us. I appreciate you.
Well, thank you, Swati, and thank you for continuing to be creative in connecting all of us together, even during these times of such uncertainty. We know that having strong elected officials with shared values and a commitment towards a more just and equitable America is really important. And I appreciate your partnership in this effort.
Awesome.